walk festival at a park in Seoul. There are even some foreigners participating. To the side, the mobile clinic for foreign workers is being held for foreigners. There is even foreign medical staff among the volunteers.
Hi, 안녕하세요. Good morning. Today I come here medical volunteer.
My name is Phan Quốc Dũng. I come from Vietnam, and I'm a doctor in cardiovascular intervention. And now I come to Korea, and I live in 1 year.
The foreign doctors traveled a long way to come to Korea.
This is my country traditional musical instruments.
Why did they come to Korea? The mobile clinic for foreign workers was held at the Walk Festival for the foreign workers without healthcare benefits. One of the volunteer doctors is Dr. Alimov from Uzbekistan.
In Korea, medical service very civilization and very modern. Let's visit in Korea. Very interesting, very useful in my life.
저희가 인하대병원이 주로 이제 이 국내 진료뿐만이 아니라 다른 이제 외국인 진료나 이런 데서 많은 역할을 하고 있거든요. 그리고 저희 병원에 좀 많은 이 외국인 의사들의 연수를 하러 와 있습니다.
Foreign medical workers are currently training at various departments in Ina University Hospital, including ophthalmology, cardiology, and urology. Dr. Alimov is currently in training at the dermatology department in Inha University Hospital. He's making the rounds with Korean dermatologists. This is a time for him to learn about various skin diseases.
My country, many patients treatment medication, a lot of treatment, medication treatment. In Korea, maybe 50-50, and medication and equipment treatment.
In Uzbekistan, where procedures using dermatological medical equipment are in its early stage, the laser procedure is a new field.
I'm interested in Korea leisure clinic, because my country not modern leisure equipment, modern leisure treatment. Because I like here learn and study in leisure dermatology.
For the past 5 years, over 75 foreign healthcare workers have gone through training at this hospital. Except for the foreign healthcare workers who are here on their own, over 450 medical workers have had their training in Korea through medical training programs supported by the Korean government.
시설이라든가 또 이렇게 발전되는 그런 의료 환경에 대해서 많이 들을 수가 있고, 그런 것들이 그 나라 사람들에서 입장에서 볼 때는 우리가 이제 이렇게 이러한 방식으로 따라가면 되겠다라는 어떤 생각이나 그런 것도 가질 수 있는 거죠. 그래서 보다 발전적인 어떤 그 모델로 대한민국이 많이 각광을 받지 않나 이런 생각을 합니다.
A Korean class at Inha University. As if to prove how big the Korean wave is, we can see that the foreign medical workers are very enthusiastic about learning the Korean language.
제 이름은 용입니다. 저는 의사입니다.
Dr. Young is a cardiologist from Vietnam. Dr. Young's day begins at the cardiac catheterization room. Cardiac catheterization is a procedure that inserts medicine to the coronary artery to diagnose heart diseases. Sometimes he even participates as the main operator.
I'm very scared, very scared. Yeah, because it's very important. This procedure is very important for the patient. So I'm scared that I cannot do. I'm scared. But professor told me that, oh, don't scare. Because you do with me. So if any problem, I will help you.
A chance to participate in a surgery is not common for foreign medical workers.
이게 눈으로만 봐서 되는 게 아니잖아요. 이게 손으로 직접 하는 거기 때문에 경험을 몸으로 느껴봐야 되죠. 어차피 저 나라에 돌아가면 저 친구가 이걸 검사를 하고 시술을 직접 해야 되니까.
He has gotten so used to living in Korea that he even eats kimchi every day. When he enrolled in medical school, he says he chose cardiology for a special reason.
I choose this field because in my country the number of the cardiovascular patient is very high. So I think that if I learn about the cardiovascular intervention, I can help my patient as many as possible. So, and private reason that my mother had a cardiovascular disease, so I want to learn about it. Yeah, is the reason.
When his parents heard of his chance to study in Korea, they encouraged him, telling him that it was an opportunity of a lifetime. His year of studying in Korea is nearing to an end.
Can you read all Korean language?
Yeah, I can read.
How about this one?
Chit om hoang kieng pi hak kyu. Pi kwat hak. Yeah. Pi kwat hak.
It's an emergency. The pulse of a 60-year-old patient with arrhythmia has slowed to a dangerous level. Dr. Yoon seizes the opportunity to learn in this life-and-death situation of the patient. He is currently attending a conference on infection control being held at Ina University Hospital. Here he learns about the hospital's response system for infections that could happen anytime during a treatment.
Because in Korea, they have many conference, medical conference. In the conference, they show the new technical, the new knowledge, the new skill in the conference. And when the doctor and the professor go to the conference, they learn from it. They learn from the conference and they change the technical. Yeah, it's very good. How long will the pop-up message appear?
Conferences like this provide an opportunity to compare Korea's healthcare system to that of Vietnam.
I hope, yes, I can learn my major well. And then I come back my country and I can do the new, I can apply the new technical in my hospital for my people.
An ovarian tumor removal procedure at Mizmedi Hospital. Dr. Orgid from Mongolia is watching the procedure closely. A laparoscope is used to remove the benign tumor that is in the right ovary.
Only our chief of department, he does laparoscopic surgeries. I have impression that Korean surgeons, they have good surgical skills, especially good in laparoscopic surgery because, for example, in Mizmedi's hospital, 99% of surgeries, gynecological surgeries are done laparoscopically.
At Mizmedi Hospital, most of the gynecology surgeries are done with laparoscopes. The hospital's high success rate on the test tube baby procedure is well known overseas. Patients even come from Russia and Mongolia for the procedure.
Все за один день, так быстро вообще. Никаких болевых, как, допустим, я не знаю, мы привыкли в больнице, да, вот там какие-то такие страхи испытывать. Вообще здорово, на самом деле.
Dr. Orgit studied medicine in Russia. What is it like for her, meeting a Russian patient in Korea?
We don't have all the instruments we required for to do certain surgeries. For example, we don't have oscillator in our hospital. We don't have roomy manipulator, roomy system. We don't have. So we can't. We are limited by techniques. We are limited by instruments, laparoscopic instruments.
되게 에너제틱해요. 예, 그래서 모든 걸 다 경험해보고 싶어하고 또 책을 샀을 때 제일 좋아하는 걸 봤거든요. 예, 몽고에서는 책을 사기가 좀 어렵대요. 예, 그래서 가장 최신판 부인과 교과서를 사고 너무 좋아하고 기뻐하더라고요.
Every day in Korea is precious to Dr. Orgit because she's only here for 3 months. Today she's in Jeju Island to attend a gynecologic laparoscopy conference. Korea is fast in accepting laparoscopic and minimally invasive surgeries. Today's presentations will provide a good opportunity for Dr. Orgit to learn about the level of and trends in laparoscopic surgeries in Korea.
Mongolian doctors will be also able to perform all laparoscopic and hysteroscopic surgeries like in Korea, that we will be able to afford ourselves to have all the instruments and all the IT technologies which Koreans have.
Meeting talented medical professionals has been another benefit to this conference.
우리나라가 그 아시아 존에서는 의학 쪽이 그 제일 선두 그룹이니까 외국에 힘든 데 가는 것보다 훨씬 낫고, 그리고 아시아 존이니까 생각이 민족은 틀리고 그렇지만 또 좀 비슷해요. 그리고 대부분의 병원이 오면은 어느 정도 서포트를 해주려고 노력을 하고 그러니까 그 사람들 입장에서도 일거양득이죠.
Dr. Orgit, who grew up in landlocked Mongolia, saw the ocean for the first time here in Jeju Island. What thoughts must be running through her mind as she looks at the sea?
Learn in my training as much as I can and be able to realize my knowledge in practice, medical practice back in Mongolia.
New opportunities found in the faraway country of Korea. These foreign doctors who have come here and matured much will go back home and become wonderful physicians who will do their best to help their patients.